Water fluoridation is the practice of adding fluoride compounds to the public water supplies for the purpose of reducing tooth decay. The policy, which began in the United States in the 1940s, has been hailed by the Oral Health Division of the United States Centers for Disease Control as one of the top 10 public health achievements of the 20th century. However, a growing body of science indicates that fluoridation is neither safe nor effective. In this video, we examine why over 2,000 health, scientific, medical, dental, and environmental professionals are calling for an end to fluoridation worldwide.
Water fluoridation is the dispensing of a drug.
This is a way of delivering a medicine.
Fluoride is a drug, is a medicine.
Fluoride is being put in specifically to alter you physically, to make a physical change in you.
This is not chlorine. This is not any number of the other chemicals that are used to treat the water, make the water safe and drinkable.
It's not like chlorine used to make the water supply safe and kill the bugs in the water supply.
This is the only thing anywhere in the world that gets added to the municipal drinking waters to actually treat the human, to treat the body.
There is absolutely no drug on the market that's given in a one-dose-fits-all situation.
It's absolutely obsolete. It's in modern pharmacology, it's so clear that even if you have a fixed dose of a drug, the individuals respond very differently to one and the same dose. Now in this case, you have it in the water and people are drinking different amounts of water, so you have huge variations in the consumption.
You can have an athlete, a laborer, who are drinking many, many times the amount of water. You can have someone who's diabetic, who's drinking a ton of water compared to the average.
I mean, the whole name of the game in pharmacology is to deliver the right dose to the right person at the right time. And that's not what fluoridation does. It can't do it.
I would prefer an individual use approach. I would have no problem with a doctor or dentist prescribing fluoride for a patient that he was keeping in touch with and monitoring for possible side effects and for the efficacy of the drug. That's essentially what's done with any other drug, and that's the way it should be done for fluoride. We don't put other things in the water to try to keep everybody's blood pressure down or everybody's stroke risk down, and there's no reason why we should be trying a one-size-fits-all approach for this either.
Medicate each other whether they want it or not. And if 51% of the voters say we're going to medicate everybody in town, and they all get medicated.
Fluoride is not an essential element.
There's not a bodily requirement for fluoride.
Fluoride is not an essential nutrient, certainly as far as the UK goes. You look it up in the books to see what our Department of Health says, and they say that no essential use has been found for fluoride in the human body. So it is not in the category of a vitamin, and apart from anything, it's miles more toxic than any other vitamins.
Whatever benefit there is from fluoride on teeth is topical rather than systemic.
It's been shown that it's really a topical effect principally rather than a systemic effect.
It's effective topically, not when it's swallowed.
There's no reason for people be exposing themselves, all their internal organs, to fluoride when, if it works, you can do something topically.
If you want to prevent sunburn, you don't drink suntan lotion, you put it on your skin. And so if you want to have the benefits of fluoride in oral health, what you do is put it on the surface of the tooth and not drink it.
One of the things that the proponents are very careful to stay away from is to mention how many people don't fluoridate.
Most of the Western world does not fluoridate their water. We are definitely in the minority in the fact that we push water fluoridation.
Many of the countries in the world, the developed countries, no longer fluoridate, never did fluoridate.
Most European countries do not fluoridate. Austria, Belgium, the Netherlands, France, Germany, Sweden, Norway, Denmark, Iceland, Italy, Greece, Portugal. The overwhelming number of countries in the world do not fluoridate, and guess what? Their teeth are just as good, if not better, than ours.
I think the ADA's recent statement on warning against adding fluoridated water to baby formula is a watershed decision.
The American Dental Association has finally done what it should have done years ago, and that is to tell parents not to use fluoridated tap water to make up formula.
The American Dental Association recommends that we not have fluoridated water be used for making infant formula or for infants to drink.
One of the messages which I think is extraordinary in this whole issue is that the level of fluoride in mother's milk is so extremely low. It's 0.004 parts per million, which is 250 times less than we put in the drinking water.
There have been a couple men who have said, well, maybe mother's milk is flawed, but most scientists don't go that route. They say mother's milk seems to be the best we have, the best we know of, and if it's low in fluoride, maybe that's what we should have for infants, is low fluoride.
Nature has devised a system for keeping fluoride away from the infant, and we're circumventing that by putting fluoride into drinking water. And I think there are consequences.
I think parents should know that fluoride is an extremely active chemical when it gets into our body. It can interfere with the pineal gland. It can interfere with the thyroid gland. The thyroid gland and the pineal gland are both intimately involved with brain development, mental development.
A real concern with young kids, especially with newborn infants, is that the blood-brain barrier is not fully developed at that point, and when children are drinking a formula made with fluoridated drinking water, they're getting a huge, an inappropriate dose of fluoride in the developing brain. This may be part of the reason, for instance, of the depression of IQ that we've seen in these Chinese studies.
Since our study was published, has absolutely confirmed what we predicted and what we reported in 1995.
There are now 30 animal studies which indicate that fluoride could damage the brain. And this comes on top of a number of studies from China which indicates that fluoride lowers IQ in children.
I mean, there's lots of epidemiological evidence now that, for example, it might affect the intelligence of the child, coming out of China, and that's been reviewed by the National Academy of Sciences. They say that you can't be absolutely certain about it, but there's quite a strong indication, and we need further research.
In my view, fluoride today, as far as intelligence and the brain is concerned, is where lead was in the early 70s. In the early 70s, scientists knew that high levels of lead could cause brain damage in children and other health effects, but they felt that subclinical levels of lead were okay. I think the same thing is happening now with fluoride, that it's only a function of getting more and more sensitive tests to show that even lower levels of fluoride can cause lowering of IQ and other subtle effects.
You know, while these bits of further research are going on to elucidate what the absolute truth is, we should be taking a more precautionary stance and saying, okay, for the time being, we don't fluoridate.
We have several studies, as a matter of fact, in the United States that have shown that fluoride can increase bone fracture rates.
Peer-reviewed studies in prestigious journals such as the Journal of the American Medical Association that's showing increased risk of bone fracture based on the amount of fluoride that a person consumes, and consuming it in the level that people get from drinking fluoridated drinking water.
We do know from animal studies that the strength of the bone actually starts to decline the more fluoride you have in the bone. The fluoride makes the bone more brittle.
Sufficient accumulation of fluoride in the bones seems to make them weaker. It makes them more dense on X-ray film, but this is associated with a more brittle structure.
Of course, we're concerned about hip fractures because that's a huge cost to the healthcare system.
Hip fracture in the elderly, in all too many cases, means that that person is not going to walk again or will even die.
It's well known in the endemic fluorosis areas that the first sign of skeletal fluorosis is aching joints.
The early stages of skeletal fluorosis are associated with bone and joint pain.
Fluoride causes symptoms identical to arthritis.
You cannot distinguish the fluorosis or early fluoride poisoning from rheumatoid or osteoarthritis. It's very much the same.
Nobody, to my knowledge, has yet looked carefully at fluoridated cities or fluoridated populations and looked at the symptoms of arthritis to determine whether or not fluoride is contributing to this endemic or possibly epidemic of arthritis that we have in North America.
I think there's every reason to be concerned that today fluoride is one of the factors contributing to the epidemic of arthritis in this country. According to the CDC, 1 in 3 American adults have some form of arthritis. That's 68 million Americans.
Supposedly the fluoride exposures in this country are not usually high enough to get to skeletal fluorosis, but again, that's an area that really has not been studied well. I think it's likely, it's not a given, but I think it's likely that a lot of early stage skeletal fluorosis does show up as bone and joint pain, but it's never recognized as being skeletal fluorosis.
If I was an arthritic individual, I would be eliminating every possible source of fluoride exposure that I could think of.
If you ask most dentists and ask them what they're putting in the water, most dentists would say sodium fluoride, pharmaceutical sodium fluoride, the same stuff that is in toothpaste.
They have absolutely no idea that it's, in 9 out of 10 cases, hydrofluorosilicic acid, and that hydrofluorosilicic acid is a waste product for the phosphate industry.
This has come about because for maybe 100 years, the phosphate fertilizer industry put out 2 very, very poisonous gases into the environment, hydrogen fluoride and silicon tetrafluoride. Eventually, they were required to capture those, and they did it with a wet spray, water, and that water converts these 2 very toxic gases into hexafluorosilicic acid. And it's this scrubbing liquor, which is about 25% strong, is put into tanker trucks, driven around the country, and added to our drinking water.
If this stuff goes out the stack, it's an air pollutant. If it goes directly into the water supply, if they take that scrubber liquor and dump it into the local river, it's a water pollutant. But if they put it into a tank wagon and sell it to somebody, a water authority, like magic, it's not a pollutant. And they can take that then to your drinking water supply and not discharge it into your river. They just charge it directly into your drinking water supply, slowly bleed it in, and as magic, it's no longer a toxic pollutant. It's now what's called a product.
It's never purified. It's not a pharmaceutical grade compound. It's a mixture of whatever that collects in the stack gases. And it contains lots of contaminants, a lot of heavy metals.
When you're talking about adding fluoride to drinking water, you're not just talking about adding fluoridation chemicals. You're talking about adding all of the industrial waste byproducts that come along with it. In Oregon, where we've got 135 communities that already exceed the drinking water standards for arsenic, the idea of adding any more arsenic to drinking water, even if it's a small amount, just doesn't make a lot of sense. I find very few people who actually, with an open mind, read through the science, understand the significance of the questions and what the direction that all the new science is pointing in terms of the risks of fluoride, who still go on to say we ought to force it into everybody's drinking water.
We have better ways of improving dental health today than using fluoridation. And let's be sensible about it.
It doesn't work systemically. It works topically.
It is unethical. It is unnecessary. It's ineffective. It's dangerous.
I mean, this is so obvious. It's so really very, very far-fetched. You have the teeth there, they are available for you. Why drink the stuff?